What if a GLP-1 medicine known for weight loss and type 2 diabetes was also linked to lower breast cancer rates? That is the question behind a new study on GLP-1 medicines. Welcome to Science My Health, your channel for health and research information. Researchers looked at health records from women who had breast imaging and found that those exposed to GLP-1 medicines had a lower rate of breast cancer than those who were not. This does not prove that GLP-1 medicines prevent breast cancer. It shows an association. But it is a strong enough signal that researchers say it deserves more study. Why did researchers ask this? Extra body weight is linked with a higher risk of breast cancer, and weight is considered a modifiable risk factor. That means it is one of the risk factors that may be changed. GLP-1 medicines can support weight loss and improve metabolic health. The article also notes that these medicines may reduce inflammation, which is one reason scientists are interested in whether they could affect cancer risk. So the question was, are women using these GLP-1 medicines being diagnosed with breast cancer at different rates? How did the study work? Researchers used electronic health records from a large health system connected with the University of Pennsylvania. They looked at women who had breast imaging between January 1st, 2022 and June 30th, 2025. The final study group included 111,646 women ages 45 to 80 with a BMI of 25 or higher and a documented imaging result. Out of that group, 15,264 women had GLP-1 exposure before their breast imaging exam. The other 96,382 women did not have GLP-1 exposure. Then researchers compared how many women in each group were diagnosed with breast cancer during the study period. What did researchers find? The difference was noticeable. Among women exposed to GLP-1 medicines, 247 out of 15,264 were diagnosed with breast cancer. That is a diagnosis percentage of 1.62%. Among women without GLP-1 exposure, 2,381 out of 96,382 were diagnosed with breast cancer. That is a diagnosis percentage of 2.47%. The researchers also used a matching method to make the two groups more similar. They matched women based on age, race, ethnicity, BMI, breast density, and history of type 2 diabetes. After matching, breast cancer was still lower in the GLP-1 group. In the matched analysis, GLP-1 exposure was associated with about a 30% lower odds of breast cancer. The absolute risk reduction was 0.69%, so the difference was modest for an individual person, but meaningful enough to study further across a large population. Why is this interesting? This study is interesting because it looks at GLP-1 medicines as more than diabetes or weight loss drugs. It raises a bigger prevention question. Could a medicine that improves metabolic health also influence diseases linked to weight and inflammation? The article also points out that current breast cancer prevention medicines can have side effects that limit who uses them. GLP-1 medicines have side effects too, including nausea, vomiting, diarrhea, constipation, and gallbladder-related problems. So this is not about calling GLP-1 medicines a miracle solution. It is about whether they might have a role in future prevention research. Here's the final takeaway. The main finding is that in this large study of women undergoing breast imaging, GLP-1 exposure was associated with lower breast cancer incidence. But this was an observational study using health records. Researchers did not randomly assign women to take a GLP-1 medicine, and the study did not measure exact dose or length of use. So people should not start or stop a GLP-1 medicine based only on this study. The real takeaway is that researchers found a promising link between GLP-1 medicine use and lower breast cancer rates. Now they need prospective trials to test whether these medicines could actually help prevent breast cancer. Like this video and subscribe to Science My Health for more easy-to-understand health research news.